You can start.
Okay. All right, welcome, and thank you everyone for joining us today for the meeting of the New York City Health and Hospitals Finance Committee. Today's meeting is officially called to order. I would like to first propose a motion to adopt the minutes of the Finance Committee meeting held on July 21, 2021. I will poll each member individually for his or her vote. So Jose Pacan?
Yes.
Matt Siegler, who is acting in a voting capacity for Dr. Katz.
Yes.
Sally Hernandez Pinheiro.
Yes.
Benioski Peña Mora. Feni, I think you're on mute.
Yes. Can you hear me now?
Yep, can hear you. Thank you.
Okay.
Barbara Lowe.
Yes.
Great. The minutes are now adopted. So first, we're going to consider an action item with Creative Snow by Cow Bay Inc. And Joe Wilson is going to take us through the presentation. Joe, if you could first read the resolution into the record.
I do not have the resolution in front of me. Could that be brought up on screen? I don't have the copy in front of me.
Felicia, are you able to, or do you want?
John, you have it in front of you. John is gonna read it into the records.
Okay.
It's this part, John.
I think it's, yes,
It's just the top.
the top right.
Yeah.
Authorizing New York City Health and Hospitals Corporation, the system, to sign a contract with Creative Snow by Cow Bay, Inc., the vendor, for 3 years with 2 one-year renewal options at the discretion of New York City Health and Hospitals Corporation to provide snow removal services for a total amount not to exceed $6,920,000 for the period November 1, 2021 through October 31st, 2026.
Great, thank you.
Thank
Joe, why don't you go ahead
Sure.
and, thank you.
Yes, if we could advance to the first slide. Great, thank you. So for the background and current state, New York City Health and Hospitals requires professional snow removal services during the winter season. The current contracts for snow removal expire on October 14th of this year. They are currently extended through the remaining time period for the board approval. The existing contracts are with NAC Industries and Creative Snow by Cow Bay. The current vendors are also performing landscaping in addition to snow removal, but we have decided to separate these two services and bid landscaping separately in the spring to create some more MWBE opportunity. Creative Snow by Cow Bay currently provides snow removal services at 74% of the enterprise, with NAP covering the remaining 26%. And these services are provided at our acute care, Gotham, and long-term care facilities. And our previous fiscal year spend was $1,193,853. And we are proposing a contract term of 5 years, which would be 3 base years and 2 one-year options at the discretion of Health and Hospitals. We could advance the slide, please. The quick overview of the procurement is on July 6th of this year, the CRC approved an application to issue the RFP. And on July 23rd, the RFP was posted to City Record. And on the 27th, the RFP was sent directly to 18 vendors. We did facility walkthroughs, and 5 vendors attended the facility walkthroughs. And on 8/10, there was a pre-proposers conference in which 6 vendors attended. On 8/26, which was the deadline of the proposals, 5 proposals were received. On September 8th of this year, the evaluation committee reviewed the proposals and finalized the scoring. Creative Snow by Cow Bay was the highest rated proposer. And the RFP criteria, so our minimum criteria is 5 years in business, an SWB utilization plan or certification, a New York City presence with New York City customers, $3 million in annual gross sales, and multiple references of other large commercial real estate customers. And our substantive criteria was 30% cost, 30% of substance of the vendor's proposal, 20% the appropriateness and quality of the firm's experience, and 20% MWBE. And our evaluation committee was made up of 3 chief operating officers, 2 central office OFD representatives, 1 senior associate director, and 13 facility representatives. Just quickly, the vendor performance. So Creative Snow by Cowbay is extremely well regarded by the COOs who have been using the service and have found that they have not only met but exceeded the expectations of the contract. Next slide, please. In the vendor selection, Creative Snow by Cowbay, some of the elements that we really enjoyed and found to be compelling is that they are leveraging their current construction business for supplementary resources to deploy as needed. So they showed an incredibly deep bench to take care of H&H, even if their other customers became busy as well. They also had a very impressive client, though. They were serving a large bank in the Northeast that had 180 locations, as well as also serving LaGuardia Airport as their prime contractor. And they've made significant investments in GPS technology to make sure that their equipment and their people are deployed on site when they are supposed to be there. And as I mentioned previously, they have a very strong track record of success with the existing H&H facilities. Next slide, please. Supply Chain Services is seeking approval to enter into contract with Creative Snow by Cowbay for snow removal services at a cost not to exceed $6,920,000. This would be a 3-year contract with 2 one-year renewal options at the discretion of H&H. And Creative Snow by Cowbay has met the 30% MWB target, and they have partners for both labor and equipment. The 3 down listed below, Serrano, Fenton Son, is an MBE who will be providing equipment. KES also will be providing labor, equipment, and consulting as at 15% as an MBE. And then lastly, Chief Equipment, which is a WBE, will be providing equipment and replacement parts for 5%. Next slide, please. Oh, and that's the end of the presentation. Happy to take any questions from the committee.
Oh, thank you, Joe. Why don't I go around and see if any of the members have questions. Jose?
No questions, thank you.
Great. Dr. Katz?
No questions, thank you.
Great. Sally?
Quickly, NAC Industries, you had 2 vendors before. Did Creative Snow just grow to a point where it could do the whole contract, or what was the area filled by NAC Industries?
Yeah, so they were really only taking care of 2 of the hospitals and some of our smaller clinics. So I wouldn't say Creative Snow by Cowbay has grown. They've always been this large. You know, we have learned that they're actually, not only do they kind of take care of LaGuardia Airport, they also take care of several municipalities as well. So they've always been this large. And I think there was perhaps an opportunity that we had seen regarding the standardization. So we can improve the operation of it, the emergency response. And with the feedback that we had gotten from our COOs on the committee, who are really on the front line of making sure that the snow removal is done for the safety of the patients, they felt very confident with the resources with Cowbay. So I think we're able to streamline this to where we only have 1 vendor to work for regarding acute, DOSM, and long-term care. So I wouldn't say there's been a seismic growth. It's always been there, and we're now going to take advantage of it.
Okay, thank you.
Thank you. Fenioski?
No questions.
Okay, thank you. Barbara?
No questions, thank you.
Great. So I'd like to propose a motion for the Creative Snow by Cowbay resolution. Do I have a second?
Second.
Second.
Oh.
Great. Jose?
Yes.
Dr. Katz?
Yes. I'll say yes when he's on mute.
Okay.
Sorry, I thought I said yes.
Okay.
Ally, was that a yes too? I didn't hear, sorry.
Oh, yes,
Oh, great.
yes, yes.
Peniowski?
Yes.
Barbara?
Yes.
Great, I vote yes, and so the resolution is approved. Next, we have a very thorough financial update from Mr. Alberg and the great finance team he's got.
Good morning. Thank you for your time. Yeah, we thought we would, first, I think, should probably talk about some news here, bittersweet. Ms. Olson, Krista is going to be leaving Health and Hospitals, and that's certainly very bittersweet. And I'm trying to celebrate the moment. But I do just want to thank Krista, for everything she's done, for Health and Hospitals, 23 years, that's
Wow.
OMB, and then another 17 with
Not
us.
another 17.
And those are long years. Those are long years.
felt like it.
Yes, yes. I would say you measure the OMB, DOB years in dog years, right? So it's, but she's really been absolutely tremendous. And I think I had many conversations with Krista about the reasons for leaving, and hers were always very solid. And one that I take with myself is she feels as though she's done everything she needs to do here. And I think what she leaves is a tremendous amount of legacy. But I think most importantly, she really cares about training the future generation. And I think that's the big gift she leaves behind in my mind. So I just wanted to recognize that and wish you the best.
Thank you.
Well, congratulations, Krista. We are very much going to miss you. And John, I thought you said you were still working on keeping her to stay, but.
Well, I do have a resolution, and I took this out with Andy, and she says that we can pass this, right, that she can stay. So we
Okay.
drafted something up if we want to do that.
Well,
Yes.
but thank you very much on behalf of Finance Committee, Krista. It's been really wonderful, and you've been very patient with us, and you've done a tremendous job. So thank you.
Thank
And
you all.
congratulations.
Thank you. It's been an honor, and thank you all for your continued stewardship of this integral resource for the city.
Thank you.
Thank you.
Okay, so we'll try to do this. So I think the first slide here, we thought it just made sense to take a moment and just, look behind us, see, we've been climbing the mountain, let's look behind, see what we've done and where we've been. And again, these are just a couple of, those that we had picked out among many. But the first is, we've achieved over $1 billion in recurring revenue and generation and expense reductions against the $1.8 billion that was our initial target. We have more work to do here. I think we have a very solid plan to accomplish that, and we'll talk a little bit more about that later in the presentation. We've also, I think, proudly, finished the last 3 fiscal years with over $700 million cash on hand. Implemented Epic, right? Remarkably, 13 months, and we knew that that system would have many dividends, clinically, but also financially. What we've seen is a marked, sustained increase in case mix, and we attribute a lot of that to the new system that's been deployed. The other, remarkable number, and I think we're all still trying to absorb it, is that, the MyChart activation rate is over 70%. And I don't think there's many systems in the country that can make that claim. And what I take from that is that our patients are reaching out to us. They are committed to us, and then that's a remarkable thing. And we have a MyChart steering committee that's looking at ways that we can make sure that we're connecting back. And that would be something that we should, we'll all watch together in the coming year. Increased Metroplus membership by nearly 200,000 since 2015 and 100,000 since January 2020. I mean, that's remarkable, but I also think kudos to Metroplus because they score amongst the highest of all Medicaid plans in the state on quality, and they have one of the lowest cost plans in the state. And I think that is quite remarkable. I've been following Metroplus for many, many years, and that is certainly an achievement. And then NYC Cares, right? We have over 80,000 people enrolled in the program. It certainly picked up in the midst of COVID, and I think we have plans that expand that even significantly in the coming year. The city has generously allocated $100 million for this program, and we're putting that all to good use. Test and Trace, our other enterprise that we stood up rapidly, obviously we're the epicenter of the epicenter, provided ongoing telehealth and remote patient monitoring, but the numbers I think are quite remarkable. Administered over 4 million PCR tests at 100 sites, 1.5 million in public schools, isolation hotels, 25,000 residents there, successfully reached over 90% positive cases, and then providing a host of new services, including 1.1 million vaccinations of the, I think, roughly 6 million that have been vaccinated in the city. So that is quite remarkable itself. That's the first slide. The second here is, I thought what we primarily do here at this session is talk mostly about the closeout of FY21. We'll come back in December, with our FY22 plan. I mean, that budget has been set. In many ways, it's a continuation of our strategic plan that we've already, put in place. But we will come back in December with a thorough review of the budget. I will say, through the first quarter, things look just fine. We're, continuing with our progress. But we thought here at this session, we'll primarily focus on the closeout. But happy to answer any questions. And I think Matt will help us with a slide that kind of talks about the FY22 direction. We basically, despite it all, right, our net budget variance was a negative 22.8 million. So against the budget, we basically broke even. And I think when you consider that, along with the fact that we had rather significant dollars planned in terms of FEMA relief that didn't come through, our performance would have been better. But I think at the end of the year, to break even, given the last 2 years, I think we're stable. Patient care receipts came in $636 million higher than planned. Again, that's remarkable. Last year, the year-to-year increase, I think, was almost $500 million. We do need to point out that in that number, there's what we call a spin-up or an advance of the risk pool payments that we received from Metroplus. We took that action, not so much for the financial benefit, but we think it's important as we advance value-based payment that the time between when we receive our risk pool payments, our incentives, and the actual period where we're providing services, they need to be aligned. It doesn't make it's hard to do value-based payment correctly when there's a 18-month lag between payment and performance. So we've spun that up, and that also provided a $250 million benefit for us. Strategic initiatives, we'll go into a little bit more detail here, but performed well across all areas really, but we're highlighting the couple where we saw a benefit and exceeding actually the established targets. And then importantly, it's important to keep in mind that we continue to make key investments in the areas where we think it's either essential to improve patient care or also to enhance the financial stability of H&H. So we just kind of listed a couple of those, and additionally we'll go through a chart that kind of gives you that historical perspective. So we feel pretty good about our key investments are generating a return for us, including the nice Doctors Council contract agreement. We made a rather substantial investment there. So that's our highlights for the year. Any questions, or I can turn it over to James, or should I we'll just keep going, Frida? Is that fine? Okay.
Well, let's do questions at the end if we can.
Okay.
Sure, thanks, John. So just to give you a brief update on our cash through September, we closed with just over $700 million. It's about 33 days cash on hand, staying consistent with our year-end number over the last 3 years, which is obviously positive. A major reason for this was we were able to secure, with the help of the state, just over $400 million in dish funds right at the end of the month. We work closely with them, and we do thank DOH and DOB for helping us. Obviously, without those funds, we would have been closer to $300 million, which in the midst of the pandemic and even during normal operating times is, a bit too tight for us. Looking forward to the second quarter of the fiscal year through the end of the calendar year, we do have a few more major revenue items to receive in order to continue to having a sustainable cash balance. The first thing, and we'll get into a little bit more detail on it later, is our Fema funds. So we'll talk about how, we've worked with the delegation, with Senator Schumer and Congressman Torres to try to secure additional cash. We're hoping to receive about $350 million in the coming weeks, thanks to their efforts and the work that we've been doing with FEMA. In addition to that, we have our UPL and UPL conversion payments. We're also working closely with the state to get final agreements and to allow funds to flow. We're hoping that close to $500 million can flow between now and the end of the calendar year. And finally, similarly with the UPL work, we have our VIP-QIP payments for last state fiscal year, which are sort of in the final approval processes and payment processes. So we hope to get those funds of about $100 million as well. I also think it's worth noting that just in terms of keeping our cash secure as we, work through the FEMA delays and everything, we did have the opportunity to work with the city to delay some of our obligations for fiscal year 20 and 21, which is, practice for us, normal practice for them as well. So we're working with them to make sure that we continue to pay those liabilities off as this cash comes in, and we can, stay with a strong position. Anything to add there, John? Nope. So moving on to the next slide to talk about our COVID federal relief and to give some updates there. So through September as well, we've now paid out $2.4 billion in direct COVID-19 expenses. Our commitments, so not necessarily things that have been paid, but that we've committed to do, are now nearing $3 billion. Obviously, an extremely high number that we're continuing to monitor closely. To talk about FEMA again, to date, in terms of cash received, we're at $266 million. We have the additional $354 million associated with temporary staffing that we were working closely to secure, again, with the delegation and with the help of FEMA, which we do hope to get shortly. So that will bring our cumulative FEMA reimbursement and cash received to $620 million. We still believe that there are additional funds that we need associated with FEMA. Our next package will be for personal protective equipment for PPE. So we're in the midst of preparing that now, and we'll provide it to FEMA, as soon as it's allowable once our temp staffing process finalizes. So that will be next, and so we'll stay tuned for updates there. On the provider relief fund, there has not been a major change in terms of funds received. We're still at $1.2 billion, which has been the case for several months. But recently we did learn that phase 4 provider relief funds are now going to be available. So we'll be submitting an application. The application is due next week on October 26th. And we're hopeful that we will be able to secure additional funds there. Additionally, for funds that we have already received, for funds that we're counting through June 30th, we are in the midst of doing our reporting to sort of confirm the expenses that we had and going through the portal to do that. So in the coming weeks, we will be finalizing that, and we can provide an update once that's all been completed. Anything to add?
Let me do this. Yeah. So this is, you've seen this chart before, right? We had the little yellow warning signs against many of these, and we feel pretty good that we are managing these external risks fairly well. And we'll change this up for the next time, hopefully. I think the ones that really have us, concerned or not yet completely resolved is the state city Medicaid initiatives. And we've kept that one yellow primarily because we have, even though we've done great with fixing the dish problem, we've been paid for all of those, we're all caught up. But I think the big issue for us is the UPL conversion. You've heard us talk a lot about that. And even there, like we've progressed to the point where the dollars have now flowed to the plans, and we're in the process of negotiating with the plans terms to get those funds secured back at health and hospitals. So that's why we have that as a yellow. Vaccine mandate. We were very, very fortunate at the end that I think our unvaccinated rate is somewhere like 3 or 4%. So we did at the very end. We're so proud that many of our workforce, valuable workforce, decided to be vaccinated. The issue here, though, is that, just because we weren't quite sure, we needed to, take out an insurance policy, and we hired, some contract staff, particularly nurses and other support positions. And we're in the process of figuring out, the impact of that. Again, I think we're fine with it. We had to do it. But we're going to have to figure out the cost of that, and then when we come back in December, we will report the cost of the mandate, contracts. So more to come on that.
Okay, so our next section will just focus a little bit more on our financial performance. Take a little deeper into that for fiscal 21. So as John mentioned earlier, we closed the year at a pretty even 0% net budget variance. And basically, an important piece of that is that this is, again, cash-based, so the timing of the FEMA dollars arriving in fiscal 22, that was, great to receive from a timing perspective. That's where you see that impact for 21. For the patient care revenue, we talked about that a little bit earlier, but that's on the left side, the 636 million better than planned on the patient care side. We have the impact of the higher payments associated with the COVID patients. That includes both wave 1 and wave 2 from a cash perspective. We also cannot definitely ignore the importance of our initiatives, the outcomes of our rev cycle initiatives and other initiatives that came even better than planned and reflected there. We have also, on the outpatient side, performed better than or ramped up better than planned post COVID wave 2. So all that is the impact you see on the left side. You can also see a little bit there with the timing that John mentioned earlier, with the rest payments and importance of that being timely, and some of our progress on 340B and other initiatives, which we'll go into a little bit later. On the disbursement side, on the right side, really the big thing again there is more of the timing of the receipt of the offset to our spend on COVID. So we have about, in closing FY21, about 690 million or so that from a timing perspective, we're not offset in FY21, but a portion of that has come into the first part of 22, offsetting some of these costs. So we can go to the next slide. Yeah, so here, looking a little bit closer at revenue, we're seeing actuals to actuals. So how was our performance in fiscal 21 compared to where we landed at the close of the prior year, fiscal 20? Overall, patient care revenue, we were 811 million better than fiscal 20. Big components of that, or large pieces, fall into, again, our rev cycle improvements and our initiatives doing even better than last fiscal year. Also, our outpatient dollars coming in, improvement there also over the prior year. We have some Medicare rate improvements there as well. Our CMI is also higher in fiscal 21 compared to 20 by about 12.5%. So that's also influencing the receipts, the improved receipts for fiscal 21. Yeah, budget to actuals we covered already, so we can jump to the next one. Okay, so at the end of the fiscal year, we thought it would be important to bring back those, this slide and the next one, which really speaks to our staffing. And here you see basically the components of what we call our global FTEs or our global staff, which includes not just our H&H employees, but also how are we doing on the affiliate side, on the temp side, and also the overtime done by our staff. We have really focused on reducing the reliance on temps and overtime, and focused more on stabilizing our H&H employee, our body, our workforce. You see some of that in here. One thing I would say is important to mention, we don't have COVID temps in here. That's going to come relevant in the next slide when we talk about our nursing and nursing support staffing. One important piece here also to highlight is the affiliates, that our affiliates staffing at the end of the fiscal year is 134 higher than where we started. This is a reflection of our business plans and the growth initiatives where we've hired on the OR services expansion side, our comprehensive stroke centers and cardiology plans, all contributing to that higher number there at the end of our fiscal year. So a good picture and definitely in the direction that we intended for the year. Going to our next slide. So here we just wanted to look at our H&H staffing by the different areas of the staff there. For nursing and nursing support, as I was mentioning earlier, one thing that comes of importance here is that during the period of COVID, in the emergency, we relied on bringing in temps immediately to support where needed and on the targeted areas of need. That is not included in these numbers. So where nursing is down, we actually have temp staffing for nursing coming in and focused on targeting those areas that needed to be addressed during our COVID waves. Another thing that's also of importance to mention for areas of example, nursing support, for this fiscal year, we are recalibrating as part of that. So for example, in the inpatient model where we're attriting staff that is not in alignment with the model, we're not backfilling there, but are backfilling in areas where we have the need, like in areas of BHAs and those other components to support our nurses. Since fiscal 19 though, adjusting for our COVID period, we have gone up in our nursing investments on the nurses 486 and nursing support of 257. Another thing that you see here also is our investment into our ref cycle staffing over the years with 361 higher. You also see a little bit here of the increases in physician and residents to support our clinical investments. One thing, just as a preview for fiscal 22, we have also developed and funded the emergency department nursing model, so that we'll talk about more in our next meeting, but that's also important to mention. And another thing is our environmental services model has been also created and funded in fiscal 22.
Okay, so just a quick update on the revenue cycle initiative performance for fiscal 21. We achieved $392 million, which outperformed our target of $324 million by $68 million. On the left side, what I was trying to demonstrate is that against a monthly target that ranges between 24 and 38 million, some months we made it, some months we didn't, but cumulatively, we did exceed performance. On the right side, I delved a little bit into some of the initiatives, which I'll talk a little bit about. The orange line showing the actual achievement and the blue showing what the target was. The couple that I wanted to highlight is the insurance vendors, which was significantly ahead of target. There was some rapid growth associated with T2 with the test and trace core, and some of these, the two big functions of the insurance vendors, one is helping us find insurance coverage for patients. And so that rapid growth of those particular sites, these vendors helped us out quite a bit on identifying insurance for those vendors. We also had some significant performance onboarding new vendors to help us appeal medical necessity denials. So that was really sort of the components of that. Enrolling the uninsured, we continue expanding our capability. We expanded our telephonic financial counseling unit, reaching out to patients before their appointments. We continue to expand that capability, as well as centralizing a phone number to the general contact center phone line. And there is now a selection for financial counseling, and patients can be connected directly to financial counselors. As well as our documentation and coding improvements, which continue to outperform target. In this particular instance, this relates to continued both in-house documentation specialists working with providers, as well as our secondary review process. Toward the middle to end of fiscal 21, we started bringing that secondary review process in-house. And ultimately, when it's fully in-house, I think by the end of this month, that will save over $5 million on an annualized basis. We've been using a vendor for that secondary review process for the last several years. And then lastly, denials, you can see that little orange line is actually slightly negative. We did not achieve our targets with our denial initiatives. And the legend underneath looks like it relates to the left. It really relates to the right side. So apologies for that. We performed well on both authorization denials and timely filing denials, exceeding our targets for those particular categories. And in fact, we reduced authorization denials by over 30%, which was really pretty incredible. We still are struggling with eligibility denials and other sort of this generic bucket of other administrative denials. And for fiscal 22, what we've done is worked with each of the facilities to pick very specific areas of administrative denials that they're focusing on. We created targets specific to very individual denial codes, and we're working in a much more sort of laser focused manner with the facilities on trying to improve our performance on the overall denials category.
Great. John, did you want me to take this? Yeah, sorry. Okay. On our overall strategic initiatives, we beat our targets in every category. Our growth and service line improvements includes our business plan investments, like hiring physician advisors to reduce our medical necessity denials, the investments in our 340B contract efforts, our operating rooms, revenue cycle and managed care. You've heard about a lot of our success there this year. System efficiencies, just being great at the basics here with winding down some of our EITS consultant costs and other key efforts in our labs and places like that. And then our overall value-based payment initiatives, growing our primary care membership, helping folks get into the right health plan for them. We particularly succeeded on our HARP conversion efforts, so health and recovery plan, individuals with significant behavioral health and substance use issues getting into a plan that offers more wraparound services and then significant more revenue opportunity for our overall system. So lots of success across the board here, and we report throughout the year on our line of sight targets on these, and we hit 98% of those line of sight projections. So good achievement on our forecasting and tracking throughout the year as well, which you have to give kudos to the team for, because this is a lot of moving pieces. The next slide shows how we develop some of these financial strategies and where we think they move into FY22. A year ago and a little before, we're coming out of the worst of the first COVID surge and endeavoring to control our financial destiny as much as you can in a year when FEMA resources are going to be such a big deal. The curves of utilization and change like that are going to shift so much. So we focused on 5 or 6 key areas. One was in our operating rooms. Just we had them completely shut down, as you'll recall, and so or largely shut down. So opening them back up more efficiently was going to be a key. So we set up good performance improvement and accountability there, and we're going to build on that this year with some targeted investments, some wraparound investments in key specialty areas in radiology to make sure we can continue to boost our surgical efficiency and growth. We focused on succeeding in value-based payment, and we did well with some of the investments in our enrollment initiatives and other quality programs. We'll continue to get more granular there, focusing on our panel management, setting targets there, implementing the public health core, which is really part of our real workforce in succeeding in value-based care. Revenue cycle and managed care have been, I'd say, part of the foundation of our financial turnaround in the last few years, and we'll have to continue to build on that success. So that's in flight and going well. Margie talked about some of the key areas there already. We focused a lot on ambulatory care and telehealth, right? Our ambulatory areas were dramatically changed throughout COVID. The percent of our visits that are telephonic or video, and the explosive growth of MyChart. So we built upon a lot of that and seen some performance and improvement at Gotham and in our different ambulatory care areas. We got to continue to do that and then grow our virtual express care as well. It's a really impressive and important offering for us, and getting the word out about that and boosting the volume will be a big success area this year. Being great at the basics is always a good thing to have on the strategy. If we had one strategy, I'd say that would be it. But some of the key areas we succeeded in last year are our post-acute service line saw their margin continue to improve. We had the IT savings and pharmacy revenue targets and lab efficiencies that we talked about. And so this year, helping our community care division, and I think probably most important in this area, the staffing models and physician workforce plans. So, being in an area where we're structured and disciplined, staffing to our census, hiring physicians, the physician component we need for the long term at all of our facilities will be a big deal. And then, of course, the big ticket work with the state on the Medicare redesign proposals and our special populations work and the UPL conversion. Continue to have good dialogue with the state, and that work will be ongoing this year to bring in more resources with our state and federal partners on those key populations. So that's how we look going into FY22 strategically.
Okay, this slide looks back at FY21 spending and revenue for Test and Trace Core. H&H incurred about $1.4 billion in spending over the course of the fiscal year for Test and Trace. And you can see in the table at the bottom of this slide that about half of that was for testing, our largest pillar, followed by tracing, which was another $400 million. OMB sufficiently funded Test and Trace throughout the year for that $1.4 billion in expenses, and that revenue included our CDC ELC grants and Fema funding, and of course also Test and Trace received over $300 million in billing revenue at our testing sites. And just one note on this slide, the vaccine expenses here are just for the 3 Test and Trace sites, the mega sites that we run. On the next slide, we look forward a bit into FY22. Of course, COVID trends remain unpredictable, but we're currently operating most of the programming that we had in FY21, our testing sites, our mobile testing units, contact tracing, our hotels, school testing, vaccine, and canvassing. We have been sufficiently funded throughout the year to date through the remaining ELC grants, FEMA. We also have American Rescue Plan funds, CTL, and we continue to collect third-party billing revenue.
Great. John, do you have the?
We just have a couple. Yeah, we just have a couple appendix items. Again, we don't need to go through those, but it's some of the information we provided in the past. We just tucked it in the back.
Okay, great. Thank you very much for that. I'll go through each member for questions or comments. So, Jose?
Thank you so much for all the reporting. I had a quick question connected to quit rates that we are experiencing in the overall economy and how that impacts the financial planning and staffing. Are we experiencing the same things that you read in the news about? I don't know, they call it. In
I'm
some
sorry,
industries,
there's
you
a,
have
Jose, sorry, could you guys stop rustling papers in the boardroom? Thank you.
So I read about 7% quit rates in some industries. It's lower in the government sector. I don't know how, what the right rate is in healthcare, but I just wanted to know if it's something that is crossing your mind as you plan for next year.
Jose, are you thinking of in terms of the percent of our employees, percent of our patients who are privately insured? Or are you thinking in terms of workforce?
I'm thinking in terms of workforce and our ability to staff correctly, given that in some industries you have hotels and so on, you have a 7% rate. And these numbers have been increasing. Healthcare is 2-3%, but it's still rising
Yeah.
very high.
I mean, we have not so far. In fact, I just asked Yvette to look at the retirement numbers. I mean, obviously, one difference is that we are one of the few organizations that still has a retirement that's based on years of service, right? Most people who are lucky enough to have a retirement have it as a deferred income with matching. While, for us, you get 0 if you don't stay 10 years. And there's a service-related one, the more years you serve. So I suspect that keeps us relatively low. I've worried a little bit whether there would just be when Delta passes a collective exhaustion, whether there'd be a bunch of people who felt like, I stood with it, I got us through it, and boy, I'm tired. We're watching for that. We haven't seen it yet. I think our numbers are pretty low, and the ones that we're likely to have are going to be related to people who chose not to get the vaccine. So we definitely had people who had 20 plus years of service who did not want to get the vaccine who retired. And I'm gonna get Yvette to calculate that, and then happy to pass on to the board.
Thank you.
Mitch, do you have any questions?
No, I would like to think it's my influence that so much of the discussion is about being good at the basics, because that's obviously something that I believe deeply in, and I think we've executed on that really well by focusing on enrolling people into insurance, billing the insurance, coding, right? The basic things that for unclear reasons, health and hospitals, that was not the strength of health and hospitals historically, but I feel like, even in COVID, so much progress was made because of the people sitting around that table, and I'm very grateful. Thank you.
Thank you, Mitch. Sally?
I'm not sure I'm on because I think, okay, I am now. I just had a couple of little questions. Just going back to the transition of a certain number of T2 workers to create the public health corps. So I guess we baseline them into our employee base. But since we don't know if the OMB funding is recurring, I guess we'll decide what to do if and when that funding should end. But for now, I'm curious how much of the additional personnel cost was this transition? How many employees and what kinds of roles do we envision them playing?
Yeah, want me to start there? Yeah, I think I'm not specific to the chart, but I will say, right, we were fortunate enough at the end of the budget process with City Council that there was a significant bolus of funds that was allocated to health and hospitals, and part of those funds, right, is for standing up, the new core, and we're very appreciative of that. It fits in programmatically very well with value-based payment. What we've in the process of doing with OMB is figuring out a schedule to stretch those dollars out over multiple years. And I think at this point, for the number that we think, which is somewhere in the neighborhood of 300, right, staff, right?
close
We-
to, yeah.
Yeah, close to about 300 staff. We think with the dollars we have, we could stretch that out probably over 3 or 4 years.
Okay,
So that's good.
Yes.
After that, right, would be my hope, my goal, would be to have those folks actually be subsumed within the financing of health and hospitals. And I think if we're gonna be really good at the next phases of value-based payment and treating special populations, we should be able to develop recurring savings from their work to retain them 4 or 5 years from now. So that's our general plan.
so about how much is that each year for the next, say, 3
I think
years?
it's like
40.
40, yeah, about $40
40
million.
million
A
a
little
year.
shy of 40 million, yeah.
Okay, and the roles are just going to be determined that as you go along? Is that,
I can talk to the program because you have Sally, the finance people, more than the program people. What we want to focus this workforce on is connecting our patients in the clinical setting to resources in the community and connecting them back to their clinical home. So as doctors, nurses, we typically see people in offices, but we have relatively little interaction with them in their home. We're not always very good about whether people are taking their medicines, not taking their medicines, living in unsafe conditions that we could potentially change, connecting them to food banks, to better housing resources. So it's really to use these health workers to be the glue that when you're seeing someone in a primary care visit in 20 minutes, both you don't have necessarily the time to do, but also you might only be able to figure this out if you went to somebody's house. And so the hope is that they will help with making sure patients don't run out of refills, enabling people to know when to go to the laboratory. You know, there's obviously a lot that gets lost between the office and the home. And that's what we hope this group of people will do.
okay, thank you, Mitch. And my, 2 last questions. I guess in the work plan items, the compliance work plan items, Catherine mentioned that T2 was a subrecipient of 1.2 million of an epidemiology and laboratory capacity grant. Is that the flow through? It just flowed through OMB?
Yeah, it's
Is that how it
1.2
went?
billion. Yeah,
Mhm.
so DOHMH received the grant. We're a subrecipient of that, and OMB funds us
Okay.
directly with this funds.
All right, and just a little question. You had Kings County staff shifting from H&H to the affiliates.
Yes.
Is that just,
That's an effort that's underway, right, to move our small group of health and hospital physicians over to PAGNY. So that's just an effort that's been ongoing and underway.
okay, all right, thank you.
Thank you, Sally. Feniowski? Any questions?
No questions. Thank you, Frida.
Barbara?
Yeah, I actually want to share with you all my experience this morning, waking up to all the gibberish about the Biden budget, and wondered how that will affect us. Our performance has been stellar, and the commitments have been there. I'm just wondering if anyone else had a bit of a worry this morning.
John, I'm happy to try to speak to it. I think my perspective on the Biden budget is it's a question of how good it can be for us. I don't think there's a risk it can be bad. It's a broad piece of legislation covering climate change, childcare. I think the health provisions are the health provisions at risk, from my perspective, largely impact states that have not expanded Medicaid. That's probably the biggest ticket item that may be on the chopping block, which wouldn't affect New York, obviously. But there are opportunities for for good things, more funding for home and community-based services, expansion of
Right.
Medicare benefits. So I don't view it as a risk of us losing anything we currently have, just as, an opportunity, and how big an opportunity could it be? So we will
Yeah, and,
continue to help.
how
our-
soon our dollars will be reimbursed to us for the enormous costs we incurred.
Right. I think the FEMA work, I think probably sits outside this big piece of legislation. That's, Senator Schumer and Representative Torres and others have been very helpful in that, and I think will continue to be. So I do think that lives outside this big piece of legislation that's most of the discussion now.
Thank you so much.
Of course.
Great, thank you. So we're right at the hour. I just want to say thank you to the team. Great work, great presentation. It's really wonderful, and we look forward to the updates. If you can keep us posted on some of the things that the members have asked about here today, that would be terrific. Thank you.
Thank you. Thank you.
Any old business? Any new business? There being no further discussion, the meeting is adjourned. Thank you.
Thank you.
Have a great day.
Bye-bye.
Yeah.
Before we adjourn, quick motion.